Hello everybody, this is Dr. Peters, and I'm going to be doing I hate calling them lectures, but I'm going to try to talk myself through and teach you how to do a SOAP note. There is a method to the madness of writing SOAP notes. So I'm going to go through why we write SOAP notes. I'm going to go through some coding. Coding is very difficult. That's why people go to school and become specialized in being coders. And I am not a coder, I'm a provider, so it is not easy to do. So I want your expectations to be low as far as learning how to code notes. They take a long time to learn. So I am going to teach you some basics because when you're writing these SOAP notes, I really want you to understand why we're writing the SOAP notes. Unfortunately, or fortunately, there's billing involved in this and reimbursement with writing these notes. And we typically had not really taught coding in the APN 1, 2, and 3. As a matter of fact, when I went through school 10 years ago, that was not taught to me either. I got out on the job and they taught us on the job how to do coding. And so anyways, but I really feel like it's important as you're going into your first semester of clinicals and writing your SOAP notes that you really have at least a background to understand why we're writing them and why we're doing things a certain way. Are they going to be perfect? Absolutely not. Like I said, coding can be very difficult. And that's why we have coders that audit our notes all the time. So, there's been no physician, nurse practitioner, or physician assistant that's been perfect at writing a SOAP note to meet all criteria all the time. All right, so here we go. Let me get this started. Get started here. Okay, so hopefully you can see the screen. Actually, what I'm going to do here is make the screen bigger. Okay, hold on. Sorry, guys. I'm really sorry. I thought this would work. Okay. All right, so what's the purpose of SOAP notes? Well, we know it's a legal document, and communication I want to stress too, because what you're putting on that SOAP note, I want you to pretend that you're seeing this patient and someone else is going to see this patient next. So when that next person sees that patient, they need to look at your last note and be able to see exactly what you did at that visit. So that's why it's really important to be thorough yet to the point. The other thing is, what if you're seeing a patient, you want to be able to go back and look at the last note and find out what that other provider did at the last visit. That's going to help you. All right. Insurance, third-party reimbursement. That is very important. That's when we're going to talk about the coding. Progress reports is just continuing on. If you're doing follow-ups, you're looking back to see trends in vitals and weight in treatment improvement with medications. Also, we use it to collect data and to improve quality of care. Okay, so SOAP notes, write it as soon as possible before it fades from your memory. I know it's hard when you guys are students because obviously you're going to see the patient and then you won't be able to do it until, at that night or the next day or however your work schedule goes, but take a lot of notes if you can. During seeing the patient, you definitely should be taking notes in the room. It's totally fine to do that. Maybe as a student you feel a little nervous taking notes when they're talking to you, but it's perfectly normal and perfectly okay. I've been a nurse practitioner for 11 years and I take notes every single visit, every time. So it's very important to do that. When you're writing your notes, they should be organized and chronological. This is where I say when you're writing a SOAP note, bullet points are awesome. Obviously your history present illness, no, you're writing your history present illness, which we'll talk about. But when you're doing like your allergies, your social history, surgical history, they should be in bullet points. Because just remember, if you look at an electronic health record, they're mostly in bullet points. And I want to be able, again, to go look at the chart and read things quickly. As you know, there's not a lot of time to see the patient, so things need to be efficient. obviously must be legible. We're on electronic health records. You guys will be typing them. Never use I, so don't say like I am referring to or referring patient to the ear, nose, and throat, or I told the patient. Just use like nurse practitioner, seeing the patient instructed, or nurse practitioner instructed the patient to ... Use quotes whenever possible. Obviously, you don't want to quote the whole note. Don't use hyphens because sometimes they get confused with minus signs. All right, so let's talk about what the SOAP stands for. They're divided up. Now, a lot of people get confused between actually most of these, but let's try to clear it up for you. Subjective is what they know. So that's exactly what they're telling you, what they know. It's nothing that you know, it's what they know and you're writing it down. Objective is what you know, all right? So subjective is going to include everything all the way down through the review of systems, and then it'll stop. Objective, what you know. Now you're seeing the patient and you're doing your physical exam. So you're going to observe things and listen and percuss and auscultate. That's what you know. That's the objective portion, the physical exam, as well as labs. So you put diagnostics under there too. If they've had labs done in the past, or if you're getting like a urine dipstick that day, that would go there too. The A is assessment, and a lot of people, because we're nurses, we get caught up in that assessment, like what's our nursing assessment? But think of your assessment, it's diagnosis. So what's your diagnosis for the patient? And then your plan, what are you going to do? It should be a team approach between the patient and the nurse practitioner. So obviously we use our expertise, but yet we say, okay, I want you to take amoxicillin for 7 days, these are the side effects. Make sure you take it every day, have the patient repeat it back to you, tell me how you're going to take it, etc. So it's a team approach between the patient and the nurse practitioner. A great example is diabetes. I tell people I'm with you for half an hour every 6 months. You're at home with yourself the rest of the time. So I can help you come up with a plan, but what are you going to do at home? What kind of exercise are you going to do? Diet? Are you going to be taking your medicines? That kind of thing, okay? So subjective, what they know, objective, what you know, your diagnosis, and then your plan. So the next slide is documentation requirements from CMS, and this is what all the insurance companies follow for the guidelines as far as charting. Okay, I'm going to get out of this and make my screen a little bigger, which I should be able to here. Oh my Lord, it won't let me. Okay, so you can see it right here, and then I'll show you another chart. And the reason why I have a white background is that I'm going to go ahead and post this as a PowerPoint, not a PDF. So you can print it out and you can change the background to all white, whatever you guys want to do with it. Just don't change the content I have in the slides. Okay, so first of all, let's look at this, and I want to study this a little bit. This is the type of history, meaning the HPI, okay, right here. So type of history. So what kind of appointment is this going to be? Problem focused, expanded problem focused, detailed, or comprehensive? We don't know yet what they are. When the patient comes in, we have no idea. We kind of have an idea. Say you'll see on your schedule runny nose, then I'm assuming it's probably going to be an expanded problem focused visit. When you see these numbers, these are the coding numbers that are used for reimbursement. So problem focused would be a 99212 for a follow-up visit. 99213 would be a expanded problem focus, so that would be more of like, if you look at the HPI, it would be a brief history present illness. They come with a runny nose or a sore throat or a wart or their lower back hurts, okay? So that's a 99213, and 99214 is more detailed. So they have, when you look at the history present illness, there's 4 or more elements, or there's 4 or more issues going on with the patient, basically. All right, so that's detailed. That means you're spending more time with the patient. examples of this could be diabetes follow-up, and they have osteoarthritis and hypothyroidism and high cholesterol, hypertension, which is a typical follow-up office visit. Or say they have back pain, neck pain, knee pain, and then they're diabetic. Okay, so that's an example of a detailed. Don't panic yet, because I'm going to show you what things mean. Take notes, all right? I want you to write down elements and systems, okay? Because there's systems, and then under each system is what's called elements. And that's for billing, but then it's good to get to know what elements mean. Then we have comprehensive, which I rarely do comprehensive, unless I'm doing like pre-op visits. That's more extensive. So your notes are going to be not a 99212 up here. I just didn't write that in. Do not use this problem focused for your notes. That would be way too brief. Problem focused would be more like someone comes in and says, look at my mole and it looks fine, goodbye. You're not doing anything. So that's not the type of notes we want you writing, and it's rarely ever done in practice anyways. You're going to be writing these types of notes here, the 99213 and 99214. One other thing I want you to understand is when you see 99213 and 99214, that the 1 makes it a follow-up visit. If it has 0, anything 99203, 99204, that's a new patient visit. So I'll show you a table in a second. Okay, so I want you to focus on these two middle ones here. So what this means is, let's just take this. The patient comes in with the cold. All right, the history present illness, Medicare or other insurance companies are saying the history present illness is brief. So you're going to use your old carts, okay, with one of the systems. Meaning, like if they come in with a sore throat, you're going to do the ear, nose, and throat. That's, to me, one system, okay? Your review of systems, remember that's still what the patient's telling you. This means anything else that you missed, perhaps in the HPI, that could add to this issue. For your SOAP notes, write this down. You have to do cardiac and respiratory for any note, any problem, any narrow focused, etc. So always do that for your review of systems and over here for your physical exam. All right, so this is one system, meaning ear, nose, and throat. Physical exam, you need to have at least 6 elements in one or more organ system. And this is where I'm going to show you what these elements are. When you're writing your notes as students, you are more thorough. So again, I don't want you to get obsessed about this table here, because I know you guys are going to be thorough and probably use more systems than maybe would be required for an office visit. But I want to give you a background of this to say, hey, this is why we're doing what we're doing. Okay, because we see a patient with a cold, all right, and let's just say I do one system here. I'll do like the throat, do a brief one of this, and then say I miss an organ system on here and I code it this. If I get audited on that, they're going to say that I over coded on it because I didn't include this. It was missing. So the insurance will say, no, I'm not going to count that as a level 3. A level 3 equals money, okay? A level 2 is money, not as much money. Level 4 is more money as far as being reimbursed. All right, so I hope that makes sense to you a little bit. Okay, so I want to show you a table here. Let's move it over. I'll make it a little bigger. Okay. So I'm going to link this also. This is from the American Academy of Family Physicians. And look at this side here. See the 1 in the middle here? 99213, 214, 215. This side, 203, 204, 25. This side are new patients. This side is follow-up patients. Okay? So this is another thing you can print out if it'll help you. Just get an idea. why or what needs to be coded for what level. So again, let's go to this 99213. Now this one says it can have 2 or more self-limited problems, 1 stable, or an acute uncomplicated illness. So either one of those will be your problem, all right? But you need to code the history, 1 to 3 elements, any pertinent review of systems, but including your cardiac and respiratory. And then your physical exam is going to be expanded problem focus. That means you're going to definitely choose the systems that pertain to the problem they're coming in with, but you're going to also include your cardiac and respiratory no matter what. Your 99214, same thing, but it's 3 chronic stable illnesses, 2 plus or more chronic stable. You see how confusing this could be? So again, I don't expect you to know this. I just expect you to be able to, when you're doing a focused exam, you need to be able to write a good history of present illness. You need to make sure you include your social history, your past medical history, medications, allergies, etc. Do a review of systems that's pertinent to the problem that they're coming in with, and include always respiratory, cardiac. If you're doing a history and physical, then you're going to do everything on the note, no matter what. All right, so this is another documentation guideline I'm going to put in the area that I post the video. So you can print these out, you can do what you want with it, but this will help you try to understand. The earlier you try to understand it, the better SOAP note writer you're going to be, because you're going to be able to make sure that you're documenting the accurate stuff. Here's another thing I'm going to put in, and this is actually like a decision tool, so it's actually kind of cool because this does the work for you. All right, so history, present illness. You have 1 to 3 elements, let's just say. Now, let me go over elements now, since I didn't talk about elements. Elements are parts of each thing. So old carts. So O, onset, location, duration. That's 3 elements right there. All right. C, characterizing factors, aggravating factors. That's another 2. So that's 5 elements. So do you have 1 to 3 elements or 4 or more elements? Most of us do 4 or more. So I'm going to put in 4 because I'm going to do the whole old carts. And let's just say they have diabetes too. So I'm going to talk about that. Now this is the review of systems. I usually do at least 2 to 9 elements. So that means that if you do cardiac, you're going to say heart rate, regular rate and rhythm, no murmurs, gallops, rubs. Right there you just covered like 2 or 3 elements. All right. And if you do GI, abdomen soft, no bruits heard, bowel sounds in all 4 quadrants, no masses felt, no masses felt, no hepatosplenomegaly. You just covered probably like 4 or 5 elements. So that's what elements are. A system is a system, but there's elements under each system. So what they're looking for are elements. And we always put 2 or more elements for family, past, social history. The exam, I'm going to do 6 to 11 elements because I'm sure I covered multiple elements under the systems I needed to, because as nurse practitioners, we are very thorough, right? And let's say with this patient that I sent this patient for, actually, let's say I ordered an antibiotic for this patient and some Mucinex, did a rapid strep. So I'm going to put that I did multiple management options. We did a lot of teaching. All right, number of diagnoses. So let's just say I did 2 diagnoses on this. And then the complications, so let's just say it's low because they just have a cold. So now I'm going to calculate the result. It's going to tell me down here, based on all of these things I've done, it's a level 99213. Okay, so I like this a lot because, again, it can be very confusing on the other stuff. So, all right, so now that you have a little background on that, I am going to stop this. This will be the little coding portion, and then I'm going to start up and just go through the subjective, objective, and that kind of stuff. So, all right, I'll see you in a little bit.